It's Friday, and welcome back to another episode of MALN Opinion Plus. This is a space for our opinions where we talk about current events and questions the Latino community is curious about. This week, we're joined by Dr. Danna Mauch, President and CEO of Massachusetts Association for Mental Health. Thanks for joining us today, Dr. Mauch.
Diego, thank you so much for having me.
Of course. Would you want to start off by just telling our audience a little bit about the MAMH and
Yes.
your mission, and a little bit about your role as acting president?
Certainly. So the Massachusetts Association for Mental Health was founded back in 1913. And at that time, its mission was to improve understanding of mental health conditions, help people to understand not only what the conditions were, but that they were treatable and that people could recover from them. Over the years, we've developed an agenda that's really based on that original premise. And so today, MAMH, as our acronym is concerned with advancing the mental health and well-being of children and adults in the Commonwealth and beyond, of promoting prevention services, because these are preventable conditions, of making sure people get access early to interventions that would treat them and help them to recover and prevent disability. We're advancing effective treatment and the research needed to improve treatments. And we're trying hard in our work to address the social, emotional, and mental health challenges that many of us face. In order to eliminate stigma and discrimination, we need to increase people's understanding and also the agency or sense of purpose that each of us can have in protecting our own mental health and well-being and getting help when we need it. The discrimination that comes from the stigma related to these conditions is still strong. It has improved over time, but it's still a challenge for people. And so a major part of our mission now is to also ensure the full social, economic, and political inclusion of people who live with these conditions in all aspects of community life.
Oh, I think that's such an important mission to be working towards, and it's so cool how you guys have been doing it for such a long time. And kind of touching on that last thing you said, I noticed there was a lot of, in my research and looking into the organization, there was a lot of information and statistics on the MAMH website about our communities here in America and in Boston, about the prevalence of mental illness within them. And I think it really goes to show how there's no single easily discernible cause to someone's struggle with mental illness. Could you tell me a little bit about how your guys' work reflects this, all of the multifaceted points of the issue?
Yes, I could. So we understand that many factors influence the risk that any one of us will have for developing a mental health condition or a related behavioral health condition. And those risk factors change in the course of our lifetime. Some of them cut across age spans. Poverty is a risk factor. Challenges with getting access to a good education is a risk factor. The instability that people who are in poverty experience in terms of food security, housing security, economic security related to employment, these are all factors that pose risks for our mental health and well-being. And MAMH is very aware of those things. They're what the public health professionals call the social determinants of health and mental health. And so we try to understand and define what those are so we can encourage the people who provide services to target people who are in need. So also understanding people's demographics and culture is important, because different cultures have different traditions about help seeking and caregiving. And so if we're going to be successful at helping people to understand that these are conditions that affect all of us, there are very few people you will ever meet who don't have a family member or a friend or a neighbor or a colleague who have been impacted by these conditions. And so helping people to understand that this is something that affects all of us. Some of us, are more resilient in the face of risk than others. Some are more vulnerable in the face of risk than others. And so we try to focus on preventive activities and on strengthening the fiber of our community to support people and reduce risk. But when people are at risk, we then try to target early intervention and effective treatment to them. And understanding how to deliver that treatment in a way that's meaningful in a social and cultural context is equally important. So the number of people who are Latinx or Hispanic in the United States is growing, as you know. And soon people from those communities are going to comprise, more than a quarter of our population. And the poverty rate is higher in that population than it is for the country overall. So some of what we try to do is use data to say, the poverty rate for Hispanic and Latinx people is 50% higher than it is for the country overall. We need, if we're going to try to help people's mental health and well-being, focus on solving this poverty problem. Similarly, the behavioral health needs of Latinx and Hispanic people have appeared to be, to the researchers, lower than they were for the white population. 18% of the population reporting challenges versus 22% for the white population. But frankly, some of that may also be underreporting, and it might be the way in a particular culture you choose to identify and label a problem. What we do know is in the last 10 years, there have been increases in the rates of these conditions in the population, reported in the population, and higher risks even for the worst outcomes like suicide. But the important fact that we focus on that goes along with that is that people who have these conditions in the Latinx population are undertreated. Their access to care is worse than it is for other people. And so they may be suffering more on average because they don't get the relief that might be provided by treatment. And that's a concern to us. And it's both people who have depression and anxiety and people who have more serious conditions, let's say like bipolar illness that's severe and disabling or schizophrenia. In a 10-year period, in a study by the Substance Abuse and Mental Health Services Administration, people from the Latinx community with serious mental illness, the reporting is that actually between 2008 and 2018, the numbers reporting those conditions increased by 50%. Likely, part of that's about reporting, and part of that's about the growth in the population, and part of it's the stress of being in an immigrant community in the United States, and more pressure and fewer resources and more challenges in getting access to care and diagnosis for care. So we're very concerned about using these data to help people understand the picture and understand where and how to target resources.
Now, I wonder too, I think it's really obvious thinking about those things that racism and racial bias and people's sexuality and their individual, like just the ways that they are, can really affect mental illness. And it's interesting because it's something that also affects everybody. So it's interesting to see it applied in those contexts. How do you think looking at it and being upfront about those differences that people have can help us better understand how to help them?
I think it's very important because if we understand both the implicit and explicit biases and how they affect our interactions with one another, we will see that they're affecting the rates of diagnosis. You will see a problem in a child from a white community that may be diagnosed as a mental health problem, and in communities of color, that same problem is diagnosed as a behavior problem, and the child's not provided treatment, and they may be reported to the school resource officer. Conversely, you might see certain behaviors in a white child diagnosed as a less severe condition, whereas you might see a certain behavior in a child of color diagnosed with a more serious diagnosis and more common use of antipsychotic medication, for example. So these are problems that are driven by bias, and the quality of treatment that people are offered is definitely impacted by bias in caregiving and providing communities. And we have got to raise awareness about this and raise understanding, and also help these treaters until we can educate enough people from each of the culturally relevant communities to be treating their own communities, which is the gold standard.
Mhm.
As long as we're relying on a predominantly white culture to treat people, we have to educate the people in that culture about the cultural expressions of these conditions, about these problems of misdiagnosis and mistreatment. Sometimes it's undertreatment and sometimes it's overtreatment, and help people to understand how to do a better job for this very important community.
I think that was so well said. Thank you for that. I think
Mhm.
it is so important, especially with such a multifaceted issue, to see how it really does affect all of us, and that these sort of like systemic things, it seems really hard to change. And I like that your guys' focus seems like you're trying to get more education and more raising awareness out there.
We are, and we're also trying to use this knowledge, educate people so that they will make more resources available to these communities, whether that's budgeting for expansion of services, whether that's investing in training of people from these communities in professional capacities. All of those things are important. And, you know, for people in the Latinx community here in Massachusetts, because we have universal health insurance, you have a high proportion of people who have insurance coverage. That doesn't always mean you can use the insurance and get exactly the service you want. But across the country, there are very low rates of insurance in the Latinx community as compared to the rest of the country. So, for example, in the United States, about 18% of all residents of the United States have no insurance. But the rates of no insurance among the Latinx community, depending on what part of the world you're from, range between 33% with no insurance and 35% with no
Oh,
insurance.
wow.
That is huge. That is almost double the rate it is for the country at large.
Oh, I wasn't aware of that.
And
That's
so without
crazy.
insurance, it's very tough to get access to
Hmm.
care. Now, some of that is related to employment, because employers are the largest source of health insurance for all of us. And for many people from the Latinx and particularly the immigrant community, they may be in entry-level positions. They may be in service industry jobs that don't often have health benefits as part of the package. And then they may also be living in states, unlike Massachusetts, that do not have universal health insurance. Very few states have truly universal health insurance.
Now, I wonder, just we have a few minutes left here, and I did want to just touch on, before we have to go, your MAMH's work on systemic and legal reform in relation to mental health.
Mhm.
Could you tell me about some of the projects your teams are working on in regards to mass incarceration and criminal justice, and how these affect our communities here in Boston?
Yes, I would be happy to do that. So MAMH understands that people who are at risk for and who live with mental health conditions have some of the worst outcomes that people with health conditions in the Commonwealth and in the nation have experienced. Sometimes having one of these conditions is, instead of a pathway to treatment and recovery, it's a pathway to school expulsion, unemployment, homelessness, and incarceration. And for us, it means that we need to work on reforms in those other systems where a disproportionate number of our people find themselves. And the criminal justice system is one of those. The high rates of people with mental health conditions who are in those systems reflects our failures as a public health and mental health system. And we have to tackle reforms there to ensure that we do a better job diverting people from those systems to begin with. So we're very active legislatively and on budget and policy issues, working with the criminal justice system and the public health system to try to divert people before arrest, to even post-arrest, divert people, and then once people are incarcerated, to ensure they are adequately treated, whether that's mental health treatment or addiction treatment while they're in jail, and then or prison, and then once released, working on reforms around reentry so that people get housing and treatment services. Because if you don't provide housing and treatment to people who have these conditions when they leave jail or prison, the recidivism rate over a 3-year period is 68%. No other group with any other condition has such high rates of recidivism. And yet, with good treatment, we can totally change that picture. So that we spend a lot of time on that. Also, the last thing I'd say is that people in institutions who have these conditions have a lot of difficulty managing in a rules-based environment, especially if their illnesses are not well treated.
So I'm so sorry to cut you off here. We're getting very close to time. I just wanted to see, are there any links and resources you would like to share with our audience before we have to go?
I would. So one is a campaign focused on young people and helping them to engage to protect their mental health and well-being, called Just Ask. And the second is Network of Care Massachusetts. Network of Care Massachusetts is a database of over 5,500 services and supports for people who are seeking mental health treatment and related social services. And there's a 30,000 item library there to help you improve your understanding of these conditions and all health conditions, basically improve your health literacy. And it's available in multiple languages with a Google Translate function.
Perfect. We'll be sure to include those links in our document too.
Thank you.
I just want to thank you so much. This conversation was so interesting today, and I'm so glad we got to talk about it.
It's a pleasure to meet you, Diego, and to your audience. Please know that we're working every day to do a better job responding to your needs, understanding your needs, and thank you for your interest in these issues.
Of course. Thank you so much. And for our audience, you can join us again next week for another episode. And for more information about our discussion today, you can check out our web story on malatinonews.com. Follow us on Twitter at malatinonews and Instagram at ma_Latino News. I'm Diego Viruel with MALN Opinion Plus. See you next time.